Okay, hello ladies and gentlemen. Today basically I want to talk with you about febrile seizure. So first of all, in febrile seizure, basically we have to consider four things. Any patient with febrile seizure. So first of all, the age of the patient. The patient's age has to be between 6 months to 60 months. That's 6 years. Okay, from 6 months to 6 years. That's one. Two, the patient's temperature has to be 38 degrees Celsius or more. And also, other than that, is that the patient should not have any history of sinus infection, because they would not know whether this is due to febrile seizure. I mean, the seizure is due to fever, or is it because of meningitis, encephalitis? Okay, so that's the third criterion. And the last one, the patient should not have any history of a febrile seizure. So if you want to diagnose febrile seizure, these four should be always kept into consideration. The patient's age, patient's temperature, there should not be any history of sinus infection or history of a febrile seizure. Okay. Usually in medicine, classification makes things easier, right? Makes our life easier, makes our approach to things more organized. Like, for example, in case of febrile seizure, I want to know whether it's simple or complex, because not only, in this case, not only for just making it easier, in febrile seizure, basically, we classify in order to know about the treatment, the management, the prognosis. All that is different. That's why here, aside from making it easier, okay, better organization, you want to know about the prognosis much more. Simple febrile seizure, they have no increased risk of mortality at all. With complex, they have twofold increased risk within the 2 years of dying, right? So that's the importance of classification. So we need really to differentiate. In order to differentiate, a patient came to you with his parents, with a history of febrile seizure. He's not seizing now. He's completely fine. He's normal. He's stable. Told you that this patient had a fever that is followed by a seizure. So how are we going to approach this patient? So you will ask basically four questions. Other than the criteria we mentioned already, these are four other questions. First of all, you want to know about the duration of the seizure. You want to know about the frequency of the seizure. You want to know about the type of the seizure. And you want to know whether this patient had a neurological manifestation or not. Four questions to ask in order to differentiate whether this is simple or complex. So, basically, in simple, the seizure usually is less than 15 minutes. Less than 2, or let's say 1 per day. The type of the seizure is generalized. Typically is tonic-clonic type. And finally, it's not associated with neurological manifestation. Had seizure, that's it. Stopped, return back to baseline, he's or she's completely fine. How about complex? On the other hand, complex seizure duration is more than 15 minutes, 2 or more per day. The type of seizure is focal. For example, only my hand is seizing, my leg, just one area of the brain is affected, leading to affection of certain area in the body. And finally, it is associated with neurological manifestation. As simple as that. You ask these four questions, okay. Then you can classify this as simple or complex, then you manage accordingly. Okay, so how about, now we finish with the definition. This is the most important part. Definition, because treatment, I can Google for the treatment, very easy. But, the skills really are needed to for the diagnosis, right? So we're done now with the diagnosis. Now or the classification. Let's move on to the prevalence. So what is the prevalence of febrile seizure? Typically is 2 to 5%. 2 to 5%. This is the prevalence of febrile seizure. How about the recurrence rate? If someone who's a child, typically from 6 to 60 months, had a febrile seizure, what's his risk of having another seizure? It's 30%. If he had two febrile seizures, his recurrence risk would be 50%. Okay, let's look to the association between febrile seizure and epilepsy, because this association is really important. And we'll look to it from two views. First of all, we'll look to it from the view of those who have epilepsy, and to see how much of those have febrile seizure, and to look to those who have febrile seizure and to see how much percentage will develop epilepsy. So if you have 100 patients with epilepsy, you will have 15% of them have had febrile seizure. How about patients with febrile seizure? How much the percentage of those who will develop epilepsy? Typically 5 to 7%. 5 to 7% of patients with febrile seizure will develop epilepsy. It doesn't matter simple or complex. Well, I mean it matters, but this is the average. 5 to 7%. Okay, so this is about the prevalence and the association between it and epilepsy. Let's move on now to the diagnosis. Basically, if anyone asks you how to diagnose whatever condition, okay, even they mention something that you first time hear about, history and examination. Oh my God, you are so good. You're so perfect. How did you know that? So, history and examination. Makes sense. Okay? Basically, I just want to focus on something important in history, which is a history of otitis media, influenza, any infection that is important to be asked about, beside the other things we have mentioned in regard to the classification to know how to classify. Let's move on other than the diagnosis. Okay. So, you have basically 4 basic workup to do, okay, to keep in consideration. You have CBC, LP, neuroimaging, EEG, right? Please, okay, whenever, not only febrile seizure, whenever you order a test, I'm just a medical student, I'm learning, but this is, I always hear it, okay? You will find this, always expect this to be asked. It's almost like a knee-jerk, If you said whatever test, okay, expect those. If you are a medical student, intern, resident, expect the one who's listening to you will ask you this. Why? Why? Okay? Why did you order this test? Okay, what are you looking for? I want to do CT. This patient has febrile seizure. I want to say why? What are you looking for? Is it indicated? So, because it's just simple, I can throw whatever test I want. But what do you differentiate from a good doctor and a bad doctor? Someone who really knows why he orders that test. So let's start with them one by one, okay? Just to cut it short, okay, before we go through all the tests, if any patient presented with simple febrile seizure, completely normal, perfect, immunization history, he had all his immunization up to date, nothing significant in his history, he returned back to his normal activities, and he is, let's say, 2 or 3 years old, because the age is important, we'll mention that in a second. You don't have to do anything. Even CBC, you don't have to do anything. Okay? You just reassure, observe, and follow up. Right? Okay. So, let's go through the tests one by one. Starting with CBC. Okay? So, do I really have to do CBC? Well, as I mentioned, you do not have to do any test, even CBC. Do not mention that I want to do it for baseline, because the patient could come, you know, he's completely normal and he could have only one febrile seizure, not any other ones, and then will come maybe for next after 4-5 years, then this baseline CBC will be no use of it and you will discard it. Okay, so even for CBC you have to have a valid reason. I would do CBC, well, if I suspect that this patient has infection, right? Yeah, this is the main thing. How about glucose and electrolytes? Okay, since we're talking about the blood tests. So I might order glucose if the patient has a history of prolonged post-ictal obtundation with if he has, with poor feeding. Then at that time I might consider ordering glucose, since it might, because I'm looking for the cause. That's one thing. How about electrolytes? Electrolytes if the patient is dehydrated. Okay, electrolytes if the patient has refractory seizure. He's not responding to treatment. I'm giving him diazepam, lorazepam, all different types of zapam, and he's not improving. So I should think that this patient is having something wrong. Okay, there's something wrong in his body. Okay, from history, for example, I might know that the patient mother prepared the formula. Okay, and after that formula, the patient was continually seizing. So this is an indication where we're going to do electrolytes, right? So we finished now from CBC, from glucose and electrolytes. As I mentioned, CBC generally not indicated, except if the patient has infection, right? So we're done with the CBC. Let's go to the second part, which is the CT and EEG. When should I do CT and EEG for a patient with febrile seizure? When should I do that? Okay, to cut it short for you, just in 2 occasions. Okay, generally, I'm talking generally. The patient has recurrent seizure or the patient has complex seizure. Recurrent seizure or complex seizure. Any of these, then I will go and order for both CT or EEG. Other than that, if the patient has simple febrile seizure, just once, normal, no post-ictal symptoms, no need to order for CT or EEG. Okay, now let's go to the last part, which is lumbar puncture. I think this is the most important one. When to do a lecture? It's a good question, right? It's a good question to ask when to do a lumbar puncture for a patient with febrile seizure. Okay, so what do you think? There are certain indications, and this actually don't arise because some of them make sense. First of all, if a patient presented with symptoms of meningitis, knuckle rigidity, you have positive Brzezinski and Kernig signs, the patient is vomiting, the patient is having photophobia. Of course, if they are old enough to say that, oh my God, I'm afraid from light. So in these certain conditions, symptoms, signs of meningitis, well, that goes without saying. You will order for LP. Immediate lumbar puncture, that is followed by antibiotics, you know that. That's one. And then you remember I mentioned something about the age. The patient's age is very important because they found that from birth to 18 months of age, usually patients, if they have meningitis, the symptoms and signs are, subtle, okay? They are not really as obvious as in a patient who is older than 18 months. So, because of that, you wouldn't know. Would you take the risk? Would you take the risk of saying that this patient has no meningitis because symptoms are not really clear because of your experience? Because of that, they cut it short. They said one of the indications the patient is less than 18 months, go for LP. Presented with febrile seizure, less than 18 months, go for LP. Do not take the risk. Meningitis, mortality, well, LP, it's just a simple, I know it's associated with, risks. Every procedure, every whatever has its own benefits and risks. But well, in this patient, he could have meningitis and they could die just because of something simple like that you ignored. Okay, so that's the second indication. The third indication, the patient had a history of antibiotic usage. He had a febrile seizure, then used an antibiotic. Well, of course, the symptoms and signs of meningitis, if he had one, would not be very obvious. They are referred to as partially treated meningitis. So that's why, again, they cut it short, because you want to know, okay, all of these, or some of these indicate because you want just to, make sure. I want to make sure 100%. I want to sleep comfortably at night. I don't want to wake up the second day telling me, oh, this patient went into, ankle herniation and died. Just because, I said, oh, okay, I don't want to do a lumbar puncture because you think the patient died. And the last one is if the patient has complex seizure. Okay, you might consider doing it. Okay, so basically these are the 4 indications where you have to do LP. Right? Just to repeat, because I think that's important. If the patient has symptoms and signs of meningitis, if the patient's age is 18 months or less, if the patient has a history of antibiotic usage, right? So these are the main indications for LP, and if the patient has a complex seizure. Well, there are others, but these are the main ones. To end up, now let's go to the treatment. Just very briefly, if the patient comes to the ER still seizing, what you would give? Diazepam, lorazepam, any of the Zepam medications, but usually they give either diazepam or lorazepam, any of these. Right? Rectal diazepam. So that's if the patient presented to the ER seizing. And if the patient is having fever, you will give antipyretics. Okay? But if not having fever, you will not give antibiotics. If not seizing, you will not give the benzodiazepines medications. Okay, so in that condition, if the patient presented to the ER or to your clinic, they seized once but not anymore. Basically, first of all, very important, please do not forget about the education part. That's very important, right? Because this will give ease to the parents. Okay, tell them about the risks of recurrence, tell them what to do if the patient has febrile seizure, not to really put restraint with the patient, okay, all of these, how to manage, because because if you just put yourself in the shoes of the parents, it is not really something easy to see your kid is seizing, I'm sure it should be something scary for them. So just by simple education and reassurance about the disease, tell them it's common, 5%, it is benign, recurrence rate at 30, but still, most of the time it's simple febrile seizure, no need to worry, no need for any investigations, it's just like a normal, you can consider it something normal. By that, even if I see my kid seizing it, I might be scared, of course, but might have, less concern. Okay, would be less concerned. That's very important. Besides, to tell them how to manage. So that's to start with. Okay, so now the parents came to you with their child who seized once. So what to do? He's not seizing now. You might consider actually giving, if the patient or the parents are worried, they are anxious, you might consider prophylactic diazepam. Prophylactic rectal diazepam. You might consider it, okay? But it's not always indicated. It's not for every single patient with febrile seizure. They are still concerned, the patient had recurrence, more than they had 2-3 times, still not improving, we are scared, we don't know what to do at home. Okay, take this rectal diazepam. You might give intermittently, or if the patient had, for example, fever, you might give it to prevent. Okay, lastly, just to finish this up, the use of anti-epileptic. Basically, don't use anti-epileptics except if the patient has an increased risk of epilepsy. Like what? Complex seizure. So the patient has complex seizure, you might give antiplatelet. It can reduce the risk of epilepsy. It can. Okay, this is to end up my presentation about febrile seizure, and I hope it really benefited you. Thank you.